Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going over Tori Spelling. She's been in the news recently because of some transformation photos, and there's a lot of speculation whether this is surgical or is this filters and makeup and contouring and what's going on with Tori. Everybody knows Tori probably from Beverly Hills 90210, which was, pretty popular show back in the day. And I think she's one of the people that's kind of tagged as done plastic surgery and done different procedures. And I think it was also publicized that when she was younger, her mom told her that she'd probably need a rhinoplasty when she got into her teen years. And in fact, she did a rhinoplasty in her teen years. If we look at her when she was younger, she definitely had a more bulbous nose when she was younger. And then we see that that bulbous tip went away when she was in her mid-teens, 16, 17. So she probably had her first rhinoplasty around then. Then I think there's a lot of speculation about whether it's chin surgery or cheek surgery or implants and things. And I'm a little skeptical of that. I don't see major changes. She always had a pretty strong chin, a little more masculine kind of jawline. So I'm not sure that that was done. And as far as cheek fillers and other things in the face and lips, probably throughout the years she's done fillers, and most people are nowadays. And then I think there is another time she's done at least one other rhinoplasty, because you can see her nose change shape again, where it was still a little bit thick and wide to kind of more contoured, but unfortunately I don't think that rhinoplasty went exactly as planned, because you can see that her nose sort of warped. It got a little crooked, maybe a collapsed nasal valve on the left side there, and it looks a little asymmetrical. And possibly even a third one after that to try and correct it. But even today we can see that Tori's nose still appears a little crooked. I'm not picking on her, I'm just saying that I don't think that there's been a really recent change to her nose. One thing that I don't think should be underestimated in Tori's case is the fact that she's had 4 children, and that can affect the body, and when it affects the body it can affect the face. And I think also throughout the years, she's been somewhat vocal about, and it's been in the news, about her breast augmentations and changing the body. And I do think that's very common for women in general to get breast augmentation. But also with pregnancies, she's probably had multiple breast augmentations, maybe even a breast lift along with the breast augmentation, because the body does change with pregnancy and secondarily affects the face. So I don't think that it's just surgery alone or other things. It can be other things in people's lives that change their face. Now, if we move to her current day, there's a lot of stuff going on in the news about her face and whether this is real, is this fake, did she have surgery, is this contouring, what's going on with Tori. One of the real ways to be able to tell is to look at videos versus just photos. And then sometimes some photos leak out that are untouched photos of the real photos, and we do have a case of that with Snooki and her. And I think if we're looking at photos like that, I do believe there's some truth to what she's saying. I think a lot of the changes we're seeing are possibly more filters and contouring and photo editing than actual surgery. With Tori, I don't think people should underestimate all the surrounding things that go around with not just surgery that can make people look like somebody else. So in her case, looking more like Khloe Kardashian or somebody else, there's other things that go into that. What is that? Wearing wigs, your hairstyle, your makeup, your brow shaping, everything, the way you dress. So if you're starting to change everything to look like somebody else, you start to look like somebody else. So I think all of those things are what are working together to give her that appearance of a Kardashian. So I think, again, we're seeing a lot of that. That's just trending in the way that people are styling their hair now and wearing their clothes and wearing their makeup and contouring and filtering. We're seeing a lot of that all over the place. So it doesn't surprise me that we're seeing that with Tori. I saw one interesting interview with her. She mentions doing exosomes, and I think people should know what that is, how that can make you look younger, feel better, more attractive.
I'll watch some Jeffree Star videos.
They said my skin looks flawless. So maybe I'm looking younger. They said I looked Snooki's age. She's 33. I'm like, I'll take that.
It's the exosomes. I'm telling you. I told you, it is the fountain of youth.
I'm going to.
And what exosomes are what stem cells secrete. They're the signaling molecules that are inside stem cells. So the technology now, we have ways where people can inject stem cells, or rather than the living cells, they've learned how to extract those exosomes or those signaling molecules from the stem cells and just inject those directly. And there's many things you can do with those. You can inject them intravenously to give you overall rejuvenation and look better, feel better. And then there's ways that you can microneedle them into your skin, into your hair, different things we're doing and playing with in the world of cosmetic surgery, plastic surgery, as well as wellness and rejuvenation. And some of these keys we're starting to find out are these exosomes. So again, not surprising that this comes up in conversation with her, because it is something that's really starting to come into the marketplace and explode. And again, people need to do their homework and research on them, because there's a lot of exosomes and differences between the exosomes. So make sure you do research before you actually think about giving yourself exosomes.
Yeah, and we do exosomes at Motykie Med Spa.
I don't know if I want to be an ad, do I?
No, I'm just mentioning it because I'm just going to include me saying this.
Well, I've tried it. You know, I think I've tried injecting them. I've tried it on my skin myself. I've seen positive effects from it. The good thing about exosomes are very little downside. A lot of people are skittish of stem cells because they're like, oh, I don't want living cells in me, and where are they coming from, and I don't know. I mean, one way to get around that is to do them from your own fat, but on the other hand, the exosomes aren't living cells, just signaling molecules. So I think that people feel more comfortable with something like that rather than injecting living cells.